points are Shenmen, thalamus, hypothalamus, hippocampus, amygdala, cingulate gyrus, and anxiety point. A few of these points are named after the organs in the brain that influences emotions, instincts, basic drives, motivation, mood, pleasure, and pain. Some are named to indicate the function of the point. Shenmen in Chinese, it means a spirit gate, is one of the most important pain-relieving psychotropic points. Shenmen is the most calming and relaxing ear point. It diminishes pain, stress, and anxiety. Thalamus is a relay station of the central nervous system. It regulates senses and motor signals to the cerebral cortex and information from the cerebral cortex to the thalamus. And it sends out information to the other parts of the body. Filtering the signals is an important function, and any changes in this filtering may show physiological effects. In other words, thalamus modifies information flow for processes of attention and other behavioral requirements. Stimulation of this point is supposed to activate the pain inhibitory system. Hippocampus is a part of limbic system which is responsible for emotion, behavior, long-term memory, spatial navigation. In case of Alzheimer's disease, hippocampus is one of those brain parts that affect memory loss and disorientation. Hypothalamus. This organ does the job of connecting the endocrine system with the nervous system through the pituitary gland and maintains the homeostasis of different functions of body, such as body temperature, blood pressure, electrolyte balance, fluid balance, and body weight. Since the hypothalamus governs endocrine system, it plays an important role in controlling sensory processing and emotional behavior. It translates our emotional state into physical feelings of relaxation or tension through the parasympathetic nerve system and sympathetic nervous system. Amygdala. The main function of amygdala is emotional and social processing. It processes and stores memories of emotional events and is also involved in current emotional responses. Emotions such as fear are associated to amygdala functions. Conditions such as phobia, post-traumatic stress disorder, anxiety, and depression are seen to be linked to the abnormal functioning of the amygdala. Cingulate gyrus. The cingulate cortex is a brain region involved in emotional, cognitive, and motor tasks. It is an integral part of the limbic system, which is involved with emotional formation and processing, learning, and memory. Electrical stimulation of the anterior cingulate can induce feelings of anxiety, fear, or pleasure. Dysfunction of this area causes anxiety, worry, and fear. The central nervous system in the ear chart. This picture is one of interpretations depicting the corresponding zones for the central nervous system in the oracle. The zones for the cerebral cortex, the limbic system, the brainstem, and the spinal cord are indicated in this picture. Spinal cord. Spinal cord is a complex array of bundles of nerves transmitting signals to and from the brain. An area of the spinal cord called dorsal horn acts as an information hub, simultaneously directing impulses to the brain and back down the spinal cord to the area of injury. The pain perception inhibitory neurons are located in the spinal dorsal horn. In addition, a powerful inhibition of pain-related informations occurs in the spinal cord. Endorphin and enkephalin are the body's natural painkillers. These are morphine-like substances whose functions are similar to those of opioid-based drugs. These chemicals interfere with the pain impulse transmission and can significantly lessen the perception of pain. When a person is injured, pain impulses travel up the spinal cord to the brain. The brain then releases endorphins and enkephalins. In the spinal cord, enkephalins inhibit painful sensations by reacting with specific receptor sites on the sensory nerve endings. Enkephalins attach to certain receptors in the brain and the spinal cord to stop pain messages and influence a person's perception of painful sensations. These receptors respond to morphines and other opioid analgesics. These inhibitory systems can also be activated by brain stimulation and peripheral nerve stimulation. Brainstem. In vertebrate anatomy, the brainstem is the posterior part of the brain, adjoining and structurally continuous with the spinal cord. This structure is responsible for the basic vital life functions such as breathing, heartbeat, and coordination. The frontal and temporal lobes and amygdala are known to feed into the neural circuit in the brainstem that directly controls emotion and pain pathways. The control exerted by this pathway is bidirectional, meaning that it can either reduce or enhance pain. This pathway mediates the pain-relieving effect of endorphins and enkephalins. The endorphins are thought to block pain principally at the brainstem. Stimulation of a certain area in the brainstem produces the relief of pain. This analgesic effect arises from the activation of descending pain modulation pathways. Anti-inflammatory points. According to the Chinese system, anti-inflammatory points are located along from the superior helix to the helix tail. The technique of bleeding points corresponding to the anatomical zones along this area is used for the treatment of inflammation. Adrenal, interferon, endocrine, and Shen-Man points also are known as anti-inflammation point. Muscle relaxation point. Muscle relaxation point is located on the wall of the concha where the extension of the helix root meets the anti-helix. Shen-Man and sympathetic nerve point can be added for muscle relaxation. Benefits of ear acupuncture. Ear acupuncture offers access to reflex points to the central nervous system. Ear acupuncture can be used by itself or complementary to the body acupuncture. Ear acupuncture offers optional treatment devices, especially for people who are afraid of a needle. Other non-invasive devices can be used for point stimulation. Ear acupuncture devices. Besides acupuncture needle, there are other devices such as electric stimulator, ear tag, ear seed, ear palette, and acupressure earring. This is the brief summary of ear acupuncture for the treatment of pain, and I hope it is informative. If you need more information, please visit earringtherapy.com or email to namjon@sprynet.com. Thank you.